To make a long story short, in 4.5 weeks post-surgery, Tommy ran faster than he did prior to surgery with zero pain. That's one case. We had another kid from St. Cloud, a hockey player for the Carolina Hurricanes. The doctor did a surgery, was scheduled to do an ACL and an MCL surgery on him, and they sent him to us to the clinic for approximately 3 days prior to surgery. That's our pre-surgical protocol. He came into the clinic. We worked with him 4 times on a Monday, 4 times on a Tuesday. We sent him back for surgery, and he had the surgery. 2.5 days after surgery, he was riding a bicycle with full range of motion. 5 days after surgery, his surgically repaired leg was stronger on a Cybex test than it was prior to the injury, evidenced by the tests that they do in the players. To make a long story short, 3.5 weeks after surgery, he's holding a wall squat for 5.5 minutes, started playing hockey 5 weeks after he got the surgery.
All because of the results you were able to attain through the ARP wave system.
Absolutely. Again, the first step is make sure that the nervous system is firing correctly. Second step is get rid of all the issues caused by the muscles not doing their job. Third step is bring up the strength curve to where you can prevent injury in the future.
Let's say, for instance, someone listening right now is up in Grand Forks. We have Fargo, wherever our signal travels, and they can't get into one of your clinics. Is there still something that you can do for them? Is there something they can do?
Absolutely. Because we work with athletes all over the world, we had to come up with a way that we could facilitate the treatment, say, in Italy, as an example, where they can't come to us, and we work with AC Milan and a variety of other organizations over there. So we created a way that we can treat you in your home. We send a piece of equipment out to you, and I think you have one at the house right now in the post-surgical side, in the post-therapy side. And we send that to you, and then we set up a webcam session just as though you're in our treatment facility. We go through the whole treatment right in your own home, right over the webcam. At the end of that treatment session, we then leave that device with you to do your therapeutic rehab as though you're doing it, and it's the same cost, the same everything as you're sitting in our clinic. So anywhere they're at. Now, if they're within a 200-mile radius, we have what we call the ARP squad. Our therapists will go to their home or they'll go to their office. If it's beyond 200 miles, we'll basically do it over the website.
I think we've already partially answered this, but how does your system speed up recovery from surgery? Let's say you went and had a surgery. How can that make it quicker? Because you mentioned a couple times where they were going 6 to 9 months. You were getting 5-6 weeks.
Sure. Any doctor will agree with the fact that, first off, whenever we hear 5 or 6 months, it's based on historical data, things that have happened in the past. And it takes into consideration what your body can do by itself. It does not take into consideration using an external source to speed up what your body can do by itself. In your case, as an example, we were contracting your muscles at 500 times a second. You're physiologically able to do it at 2 times a second. So now all of a sudden we've dramatically changed how fast you can contract your muscles by using an external source. So by using that external source, we ramp up the blood supply and we improve the muscle's ability to absorb force. And there's not a doctor in the world that will disagree with the fact that if you can increase blood supply to a given localized area and take the force out of that area, that tissue will heal much more rapidly than it would on its own.
Why do we have so many athletic injuries, in your opinion? I mean, because it seems as though the National Football League, they have an injury list every week, and there's 10, 15, 20 players, it seems like, on every team's injury list.
Mm-hmm. I think the reason is that we don't look at the neurology of an injury. We only look at the physiology of an injury. And we do nothing to do anything about preventing injury. As an example, we could go into any organization, whether it's a high school team, whether it's a business, whether it's a professional football team, and we can do a very simple test, and we can identify who's already hurt or who's going to be hurt just by the mere virtue of seeing how the nervous system is able to fire the muscle. Now, I think when you are 2, 3 years old, you don't know how to move incorrectly. When you're 4 years old, you start to learn how to move incorrectly. And from the point of 4 years old to when you are right now, you've moved incorrectly. it's a compensation pattern. You start mimicking your environment. When you lift weights, we lift weights primarily to get bigger, stronger, and faster. We don't lift weights primarily to prevent injuries. Therefore, the bigger a muscle gets, the stronger it gets, the shorter it is. And the shorter the muscle, the less force it can absorb, so we're actually training you to get hurt. And we do a great job of it because everybody gets hurt.
Why are there so many of those we talked about earlier, the repetitive task injuries like carpal tunnel? Why are there so many of those?
Well, you know, the average person who works in a secretarial pool or the average person who works in a business doesn't think that they have to train their body to perform the task. They just think they can perform the task. Well, what makes you think you can move your hand 500 to 1,000 times a day over 20 years without having a negative effect? You've got to prepare your body to do the task. We don't prepare our bodies to do the task. I work with a lot of athletes from the Soviet bloc, and their traditional philosophy is something that I really, truly believe in, and that is they don't train you until you're ready, until the body is able to perform the task. In this country, we do the task to prepare the body to do the task. You play golf to play golf. If you were in Europe, they'd train your body to play golf, and then you'd play better golf. Big difference in those two philosophies.
Makes a lot of sense. What was, I know, but explain to the listener what the ARP Wave Clinic experience, what that is.
The ARP Wave experience is totally different than anything a patient's normally gone through. The first thing we do is we have you fill out the normal medical history, which basically tells us where the problem ended, not where it came from. and everybody's dealing with that. So we do that just to simply find out where the problem ended up. And then we'll do a muscle test to determine, is the nervous system firing correctly or isn't it? It's a non-invasive test, very, very, very easy to do, and doesn't take any effort on the person's part. Then, just like what we did with you, we said, okay, this is what's going on, this is what's not working, and then they go see the doctor. The doctor then simply turns those switches on. We're not looking for structural change. We're looking for neurological change, if you recall how that worked with you. Then once that's done, then you come to the therapist, and the ARP therapist basically identifies, okay, where do you feel pain? And you point to where it feels pain. We put electrodes on that area. We turn the power up. We ask you what you feel. Generally, as you saw, it's not there. So we start searching, and we can identify exactly where that signal is coming from. And once we do that, we then treat that for 10 sessions. And then after that, we put you into therapeutic exercise where we give you an electric device to go home with. And during that period of time, over those 30 days, we're going to communicate with you to make sure that you're using the device correctly, make sure that you're getting the results that you need to get. So it's a completely different experience than anything you've ever experienced.
I'm assuming and hoping we have listeners that are certainly curious, would like to find out more, and have questions of their own. We'll take questions on the show next Sunday. If
Absolutely.
people want to email us, booth@kfan.com, where we normally accept our emails. We'll collect them. We'll look through them throughout the week. We'll pick some. Depending upon how many we get, we might have to weed through some of them. But booth@kfan.com. If people have any questions right now or want any information, they can go to arpwave.com, correct?
That is correct. And that will lead them through a very quick evaluation process, and we can determine very quickly if we can help them or not.
That's booth@kfan.com with questions about your own situation, or arpwave.com, ARPWAVE. Dennis, thanks a bunch. Dennis Thompson of the ARP Wave Clinic, the founder. I'm the common man, Dan Cole. This has been the House of Pain. We'll be back next week at 7 o'clock in the morning, Sunday morning, right here on The Fan.
All right, everybody, we now get you back to ESPN Radio, already in progress.